Chapter 25, Anger and Aggression. Anger may be directed outward through overtly aggressive or violent behaviors, or it can be expressed through passive-aggressive behaviors. Anger may result when basic needs are not met. How a person expresses their anger depends on their impulse control. Acting out is the use of inappropriate or destructive behaviors to express emotions. Passive aggression involves indirect expression of anger through subtle, evasive, or manipulative behaviors, like eye rolling or sighing heavily. Violence is a behavior that threatens or harms other people or their property. A violent act involves actions of force that result in abuse or harm. Assault is a legal term that describes any behavior that presents an immediate threat to another individual. Battery is the unlawful use of force on a person without their consent. Anger and aggression in society is shown differently depending on the cultures of the individual, and it can also depend on the different genders in society. Crying is the way infants talk. This is how they let us know when they are happy. They will coo or babble, or whether they need something and they will cry. Crying may also be a sign of danger when the infant's needs are not being met. In toddlers, the most aggressive acts occur over toys. To adults, it may appear as fighting, but to the child or the toddler, it is learning how to get along. They have not yet learned how to say, "Let's play." Children ages 2 to 5 years decrease their physical aggression as they begin to use words to communicate. Knowing what to expect from normally developed children is critical for the nurse. Gender violence throughout the life cycle. Pre-birth, the sex is selective abortion. Think during pregnancy. Think of countries like China, India, or the Republic of Korea. There's also forced pregnancies, which think about mass rape in war. During infancy, there is female infanticide, emotional and physical abuse, differential access to food and medical care for female infants. Girlhood, there's child marriage, genital mutilation, sexual abuse by family members and strangers, differential access to food and medical care, and child prostitution. In the adolescence, there is dateship and courting violence. There is coerced sex, sexual abuse in the workplace, rape, sexual assault, forced prostitution, and trafficking. In the productive age, there is an abuse of women by male partners. There's marital rape, dowry abuse, and murders, partner homicide, psychological abuse, sexual abuse in the workplace, sexual harassment, rape, and abuse of women with disabilities. In the elderly, there is abuse of widows and elder abuse. Most of the elder abuse, because only the United States has data that's available, affects basically women. Biological theories explain aggressive behavior as a psychopathology, which is a disorder in the biological or physical makeup of an individual. The function model believes that aggression and violence fill certain functions in a society, serving as a catalyst or motivator for change and action. Aggressive behaviors are often used to achieve fame, fortune, and power. The conflict theory assumes that aggression is a natural part of all human interactions. This theory believes that individuals, groups, and societies want to further their own causes, resulting in disagreements, conflict, and aggressive actions. The resource theory is one that states aggression is a fundamental part of a society. The person who has the most resources can muster the greatest force or power. Think about China or North Korea. The general systems model, this model or theory states that the feedback loop is used to demonstrate how aggression and violence perpetuate or feed on themselves. Violence is viewed as a product of a system that must be stabilized and managed. The trigger stage is a stress-producing event that occurs. This leads to a stress response like anger, fear, or anxiety. Escalation phase, this is the building stage. At this time, each behavioral response moves a step closer to total loss of control. The crisis stage, this is the potential for danger and it is increased. During this period of emotional and or physical blowout, this is when an actual assault behavior occurs. The recovery stage is the cooling down or the winding down period that follows an emotional explosion. The depression stage involves a period of guilt. This attempts to reconcile with others. The aggressors are now aware of the assault and they genuinely feel bad about it. Assisting a client to identify triggers and learn alternative coping behaviors is a goal when individuals seek treatment related to assault or aggressive behavior. There are levels of interventions for anger. 1 is to prevent violence, 2 is to protect the individual, and 3 is to control the violence. When an individual is under the influence of drugs or alcohol, this may enhance the loss of control and make the intervention more difficult. During the crisis stage, rational thinking is often clouded by the intense emotional reactions to the situation. An individual in the recovery stage can be both physically and emotionally drained. Thinking about domestic violence against a woman, the depressive stage is confusing and dangerous for the victim. During this stage, the spouse or the significant other is displaying regret and promises to never repeat the actions. Pyromania, kleptomania, and antisocial personality disorders are considered as impulse control disorders. The potential for any aggressive acts is present in every individual, regardless of the diagnosis. Conduct disorders are often diagnosed in late childhood or early adolescence. Most individuals will outgrow the problem by adulthood and live effectively. A significant number do go on to develop social and legal problems, and they are diagnosed with antisocial personality disorders as adults. Individuals relate aggressively to others when the situation is non-threatening. These individuals that have these aggressive behaviors have no empathy. They lack appropriate guilt feelings. These individuals will bully, threaten, and are physically cruel to both people and animals. The inability to tolerate frustration leads to temper outbursts, tantrums, and reckless destructive behaviors. Oppositional defiant disorder is when the individual's behaviors are stubborn, uncooperative, resistant, and hostile, arguing with authority figures, refusing to obey orders, and deliberately annoying others. These are all common signs. Young people who have not learned how to deal with their frustrations effectively are more prone to experiment or abuse drugs and alcohol as a release for their internal conflict. The essential feature of an impulse control disorder is the inability to control an impulse to perform acts that are harmful to oneself or others. People that have these disorders often have difficulty with interpersonal, work, and social relationships. Intermittent explosive disorder acts on aggression impulses that result in assaultive or destructive behaviors. Kleptomania is the impulse to steal objects when they are not needed for personal use or survival. Pathologic gambling is maladaptive betting, wagering, or gambling. Pyromania is a pattern of starting fires for pleasure or gratification. Trichotillomania, pulling out one's hair, resulting in noticeable loss of hair. The impulse control problems encountered by nurses most often relate to clients with intermittent explosive disorders. Although an individual may experience more than one episode of an adjustment disorder in their lifetime, it is usually a short-term problem lasting about 6 months. The types of adjustment disorders include adjustment disorders with depressed mood, adjustment disorder with anxiety, adjustment disorder with mixed anxiety and depressed mood, adjustment disorder with disturbance of conduct, adjustment disorder with disturbed emotions and conduct. The first step in controlling aggressive behavior is to assess the client's potential for engaging inappropriate or violent behaviors. Each of these factors listed need to be assessed. General appearance, we note the individual's state of dress, cleanliness, use of jewelry or cosmetics. Activity and behaviors, these can be clues to violence that are often communicated non-verbally. One must be alert enough to receive the messages. Attitudes, are interactions friendly and cooperative? Listen for the quality, rate, and the amount of voice tone. Verbal communication, list for quality, rate, and amount of speech. Mood and affect, perceptions and thoughts. Have the individual describe their mood at the time. Listen to the client's conversation for form and content. Judgment or insight. Is judgment or insight clear and easy to follow? Is it a twisted path of fuzzy explanations? Is the individual's reliability intact? Do they give accurate information? For psychosocial assessment, please refer to box 24.5 in your textbook. Therapeutic interventions include establishing good communication, learning to identify the signs of potential violence, and providing a safe environment when a client is out of control. A level 3 is engaging in violent behaviors. 3 interventions at this time are available: seclusion, restraints, and medications. Even the most therapeutic nurse experiences anger. By learning to cope with personal feelings of anger and aggression, it will allow the nurse to be more successful in working with the angry emotions of others.